I wasn't sure coming out of med school that I wanted to do oncology, but I actually learned as an intern what really cases got me really excited to learn more about. And some of those were some really interesting benign hematology cases that were difficult to understand. I kind of like playing detective and being an important role in that. I also like being an expert and being able to focus on something and kind of have more mastery of a subject. I'm Doug Beach. I'm the Director of Cell Therapy and Transplant here at Penn Medicine's Pennsylvania Hospital. Here at Pennsylvania Hospital, we have a lot of volume for a relatively small group. We all do a little bit of everything, but we all have super specialization in certain areas. For me, that was a lot of hematology. I tend to treat a lot of the malignant hematology, which is things like leukemia, lymphoma, myeloma, and I'll see other cancers as well. It's very distressing, obviously, to have a new cancer diagnosis. So a lot of our first visits are just kind of educating on what's going on and laying out what the treatment plan will look like and giving the full gamut of options. One of the things that I pride myself in is lifestyle modifications. And a lot of patients will come armed with, well, what should I be eating now that I have a diagnosis? What should I be doing? So I try to spend a lot of our visits, especially our first couple of visits, talking about diet and exercise. As director of the cellular therapy program here at Pennsylvania Hospital, I'm privy to a lot of the newer technologies, and we're getting much more into targeted therapies. They're a little bit more specialized with less side effects. One of the unique things about our program here, and one of the benefits of being a smaller program, we're able to do a lot of these CAR T therapies as an outpatient. We watch them closely with our team, and if they have side effects, we quickly admit them for monitoring and for treatment of the side effects. But it leads to more days at home without being in a hospital bed, which patients really appreciate. If a patient chooses me as a provider, they can expect somebody who's evidence-based on the current literature, who has the technology and clinical trials available to them because being a part of the University of Pennsylvania health system, and someone who's open-minded and completely honest with your care. Best part of my job is the families and the patients telling me when they walk out the room that they feel better than they did walking in. And fortunately, that happens a lot. They know that I'm doing what I can to be there with them during their fight, and it tells me I'm doing my job.